You are listening to Star Podcast.
Osteoporosis is a metabolic bone disease characterized by decrease in bone mass, which effectively reduces the bone strength, making it more susceptible to fractures. Osteoporosis, by and large, is a very silent disease. It doesn't have any symptoms per se, which will help us diagnose osteoporosis. But because of the underlying disease pathology, there are some signs which can be observed with to help us diagnose osteoporosis. One is basically loss in vertical height and increase in the lordosis or the curvature of the spine. These are two important signs which will help us to think about osteoporosis. But the most common reason or most common presentation of osteoporosis is a fracture. So the bone has become so soft that patients fall from a standing height and sustain fractures, which are very characteristic of osteoporosis. So that is the end stage of osteoporotic failure of a bone where fractures happen. And the fractures can, depending upon the site of the body which is receiving the trauma, it can be either vertebral fractures, wrist fractures, or hip fractures, which are the common sites for osteoporotic fractures. Osteoporosis typically is seen in females, and there are two types of osteoporosis which can develop in females. One is the senile osteoporosis, which is age related, and the second one, characteristically confined to the females, is the postmenopausal osteoporosis, which usually starts after the menstrual period stops, which usually occurs around 48 to 52 years in females. In males, obviously, senile osteoporosis does occur and it starts around the age of 80. So, as with age and with the menopause, these are the two types of osteoporosis which people develop. But there are other categories of patients who can develop osteoporosis, like people who are receiving steroids for inflammatory diseases, people who are on long-term anti-epileptic medications, and people who drink on a regular basis and people who smoke are also at risk of developing osteoporosis. Osteoporosis typically is seen in old age, as we have mentioned before, but it can also be seen in younger patients around the teens, which is called juvenile idiopathic osteoporosis. And the treatment and the management of this condition is in similar lines as with adult osteoporosis. So with regards to the advances in treatment of management of osteoporosis, as far as the medical management of osteoporosis is concerned, still the backbones of medical management treatment are bisphosphonates, which is a anti-catabolic medication, and teriparatide, which is an anabolic medication. Apart from bisphosphonates, denosumab is other medicine which is also anti-catabolic. It is used as a 6 monthly injection, which is frequently being used. Apart from teriparatide, which is the anabolic medication, the other type of advances that have happened in the medical management of osteoporosis are abaloparatide and romosozumab. These are two medications which have recently come into the market to increase the efficacy of medical treatment. As far as the surgical management is concerned, any osteoporotic fracture, especially of the limbs, is usually treated based on its pattern, based on the patient's age, functional activity, and all those things taken into consideration. As far as the hip fractures are concerned, most of them end up having surgery in terms of either fixation or replacement. Other fractures which I mentioned, wrist fractures can be, if it's a extraarticular fracture, they can be managed with non-operatively with plaster of Paris. In situations where the comminution or the number of pieces are more, then it needs fixation. Other group of fractures, osteoporotic fractures, are osteoporotic fractures of the spine. In these situations, these osteoporotic fractures are managed with rest, braces, and medical management. In some situations where the osteoporotic wedge is significant enough to cause consistent pain, there is a scope for a procedure called vertebroplasty, where the diseased bone is filled with bone cement to give immediate strength and stability to the spine. So this is done in some cases. And in some rare cases where the degree of deformity is high, there may be an indication for surgery. At Star Hospitals, we do understand that osteoporosis is a silent epidemic which needs to be identified and addressed in a comprehensive way. So it needs a multidisciplinary team approach where it's diagnosed both by the physicians, rheumatologists, orthopedic surgeons, and the gynecologists. And once it is diagnosed, the treatment is initiated in the hope that appropriate treatment will prevent future fractures happening. So at STAR, we have a multidisciplinary approach in treating osteoporosis, uh, and the identification is done, and appropriate treatment is started based on the severity of the disease. And we usually follow up our patients on a regular basis and change treatment plan depending upon the response to medical management. And when a patient comes in with an osteoporotic fracture, based on the type of fracture and the area of the fracture, it is dealt with by the relevant specialists to try and get back the osteoporotic fracture fixed and get back the patient on their feet as soon as possible.
Thank you for listening to Star Podcast.